Psychosocial aspects. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. This training component was created specifically for school nurses and other qualified healthcare professionals to train non-medical school personnel. This unit is psychosocial aspects. In this training, participants will be able to understand strategies to help promote overall development and well-being, what is shared decision-making, and development issues and their effect on diabetes. Kids are kids first and foremost. Our goal is to help you promote your students' overall development and well-being. Children with diabetes are not fragile. They are not sick. They can do anything any other student can do with more planning than before. Do not let the fact that the student has diabetes influence your style when interacting with them. Rules are still rules. Expectations are still expectations. The student's diabetes has nothing to do with what you can expect of them. Strategies to help promote overall development and well-being may vary depending on the student's age, and we'll discuss common developmental issues in the coming slides. Shared decision-making with students can improve diabetes self-efficacy, adherence, and health outcomes. The student should be allowed to provide his or her own diabetes care at school to the extent that is appropriate based on the student's development and experience. The extent of the student's participation should be agreed upon by the parent guardian, the student's healthcare provider, and school staff. And the age at which a student is able to successfully perform certain tasks vary and depend on the individual. A student's capabilities and willingness to provide self-care should be assessed and respected. Preschoolers and toddlers generally do best with simple but honest explanations. It's important not to apologize for needing to give them their insulin, but rather explain to them why and then include them in decisions. Ideas include having the child or student choose where they get their blood sugar check or injection. Sometimes the anticipation of checks or injections are worse than the actual action, so it's often helpful to get diabetes tasks done as quickly as possible. It can be helpful to prepare the insulin and glucose meter in another room before administering. Additionally, children respond to the emotional cues from others, so the more anxious and distressed you are, the more distressed they will be. Distraction techniques can also help during diabetes tasks. Toddlers and preschoolers can be picky eaters. Consistency does help, and parent guardians should discuss other strategies at home to better ensure mealtime management successes. At this age, it's not possible to tell if the child is having a difficult time, stubborn, or fussy because of the blood glucose, or because they are hungry, tired, or just irritable. The answer will be found in glucose checking or in their DMMP. During elementary school or at any age, some students like to share the fact that they have diabetes with their friends and classmates, while some are more private. We must respect a student's readiness. Research does show that children who are open about their diabetes tend to cope with their diabetes better than those who keep it hidden. For those ready, some strategies to tell their friends include making sure they know it's not contagious or caused by eating sweets. Show and tell at school is a way to share with the support of the teacher. Students may begin to feel different than their peers. Sometimes talking about what makes each person unique can help students see that everyone has qualities that make them different and that all differences are okay. It may also be helpful to talk about the fact that insulin helps their body work just the same as everyone else's body, to turn their food into energy that their body needs to grow. For children, the world is supposed to be fair. Diabetes is not. Give them an opportunity to tell you more about what they think and how they feel. It is important to understand that students with diabetes can include the same foods as students without diabetes, unless dietary restrictions are listed in the diabetes care plan. Most of the time, the food police are people that are well-meaning, but comments that the student can't or shouldn't eat foods may be frustrating or confusing. A student's capabilities and willingness to provide self-care should be assessed and respected, but it's never too early to build a student's confidence. As you make treatment decisions, talk out loud. This helps the students hear how decisions are made and help them for when they're ready to participate. In middle school, there's still overlapping developmental issues, but students now have the addition of puberty, as if adolescence isn't challenging enough related to hormones. For a teenager with type 1 diabetes, it becomes somewhat of a dance. Insulin adjustments are frequent during puberty, as hormones create insulin resistance. Insulin dosing and timing will be specified in the DMMP. These physician orders may include provisions for the parent guardian and/or capable students to modify dosing. Planning for tests at school and standardized exams is also important at this time. When children don't feel well, they are less likely to perform to the best of their ability on exams. A plan for the student to perform to do their best should be outlined in their 504 or their DMMP. Some examples of accommodations include taking breaks to use the restroom, taking breaks for a snack and delaying testing, or rechecking of glucose levels. Overlapping developmental issues continue into high school. However, generally in adolescence or in high school is now when boundaries are redefined and typically become more flexible to allow for increased autonomy and independence. This can be a time of increased conflict and risk-taking, or experimental behaviors may occur. This may include not taking insulin, experimenting with smoking, drugs, or alcohol, as adolescents continue to test their limits. Because adolescents typically live in the here and now, they tend to feel invulnerable to long-term complications. Preparing for life beyond high school can be tricky with or without diabetes. Particularly if they are planning on going away for college, they will need to begin thinking about having a more active role in their diabetes. Many colleges have a diabetes network on the campus, or if they do not have any, they can even create one on their own. One simple way that we can support students with diabetes is by using language that is non-judgmental and encouraging. Here are a few terms that you should be familiar with when discussing diabetes with your student. Some tips when interacting with your students with diabetes include talking about normal, regular, everyday things before talking about diabetes, paying attention to your tone of voice when you discuss diabetes-related topics to make sure it's not different. Blood glucoses are not good or bad. They are merely information to determine the student's needs. Praise your students for completing diabetes tasks.